Okay, so this video is going to look at how to measure wrist range of motion. So I use this kind of goniometer with the long arms, but it has a flat edge. It makes it easier to rest it dorsally on the forearm and the back of the hand. So looking at wrist flexion, the patient's typically going to be sitting like this with their arm resting up on either some kind of towel or an arm wedge. So what I ask them to do typically is to come up on their elbow. You want to make sure they have a nice cushion underneath of their elbow, because that's going to be protective for the ulnar nerve. And you're going to look at flexion. I'll have you kind of move the camera around this way so you can see the side. You're going to go dorsally this way. So you want to make sure that the stationary arm is lined up midline of the forearm. The axis is obviously the radiocarpal joint, and then the moving arm is in line with the third metacarpal. And you'll ask the patient to just bend their wrist forward as far as they can, and you just follow that down. And what you'll notice is that because this isn't a completely straight joint here, there's going to be a gap. And so if you started with this down a little bit and they came down, you don't want to push down here, because then it's going to gap on the forearm. So you just have to slide it up a little bit to make sure that the gap is only right at the wrist. Okay? And then you can pull it away and check to see what the measurement is. To look at wrist extension, you would go volarly, and it's going to be the same principle. So what I like to do, their fingers should be relaxed, and so you want to slip the moving arm just between their third and fourth digit. You want to come down so that your midline of the forearm on the volar side, and you'll ask them to extend their wrist back. And it's going to be the same principle. So you don't want to press too much. There's a lot of soft tissue in the forearm. You don't want to press too hard, but you want to make sure it's flush. And then same thing into the palm. And then you pull away and you can check the numbers. Now, if somebody has difficulty getting into this position particularly, or if they have a tremendous amount of swelling on the dorsum of the hand, or for whatever reason, you can always come, and I think your book might say, to the lateral side. And you want to make sure it's lined up with the midline of the ulna, midline of the fifth metacarpal. And you can go into extension and then back. The only thing you have to be aware of is that there's a lot more mobility in the CMC joint of the fifth. So if you were to give some overpressure to check, there's going to be a lot of motion at that fifth metacarpal, which can give you a little bit of a false reading in either direction. Okay, so now we're going to come down and look at ulnar deviation and radial deviation. So with their hand flat, forearm's going to be pronated. They're going to be resting on the table. You're going to do midline of the forearm for the stationary arm, and the axis is going to be the capitate. So of course you always want to palpate to find where that capitate is. You're going to go along the third metacarpal, and just proximal to that, you'll feel like a little divot in this position, and that's right where the capitate is. So that's where your axis will be. And then you're going to line up with the third metacarpal for your moving arm. Now you'll ask the patient to swing their wrist around to the side, to the pinky side. Okay? And as you've noticed, as they've moved, your axis has moved a tad. So you need to readjust that. There we go. And now you want to make sure that you're staying in line with the third metacarpal. So you'll want to palpate where that third metacarpal is. And when you do that, you'll notice that it doesn't stay in line with the digit itself, because you do get some ulnar motion at the MP joint also. Okay, so I kind of like to feel on either side of this moving arm where the metacarpal is to make sure I'm staying in line with that. Okay, now we'll say, okay, go ahead and move towards the radial side of the wrist. Towards your thumb side, I will say a lot of times, because that's easier for the patient usually to understand. You make sure your axis is correct, midline of the forearm, and staying in line with the third metacarpal. There's not quite as big of a difference with the digit and the third metacarpal at this point. And that's wrist range of motion.